Okay, go ahead.
All right. Hi, everyone. Thank you for letting me join your group tonight. My name is Jaymi Mansinghani, and I guess I'll tell you a little bit about my experience, my qualifications. I have a little over 24 years working in layman's terms would be medical billing and collections. In professional talk, it's called revenue cycle management. And I've worked all over the country. I started in Western Montana, moved to Seattle, then I went out to the East Coast. I was in Pennsylvania. Then I went back to Eastern Montana. Then I was in Atlanta. Then I was in Louisiana. Now I'm in Glendale. And so, in all of my roles, I've worked with hospitals all over the country. Currently, I have about 20 hospitals in my current role that I'm working with, mostly working on claim resolution and denials management. I've been in this role for a long time. I always have told friends and family, don't ever pay your medical bills unless you talk to me first, just because I've seen how much room for error there can be on these bills. I kind of just guess I want to walk through that process real quick. I don't want to bore anyone with all of the high levels, high level talk or anything like that. But I think it's important for people to realize that from the moment the order is written from a doctor and for you to go see have services provided, um, other than you seeing that clinician or maybe checking in and checking out, there's really not much human intervention from that point on. I'm going to call it the account, right? After you see your provider, goes through an automation process. Maybe a coder looks at it and adds some codes, but a lot of outpatient visits are simple visit coded, or I think that might be a specific terminology for one of the healthcare systems I worked in. But the computer sometimes will just take a look at what was ordered, what the doctor put in as a diagnosis, and code it automatically. Then a claim automatically gets created with the charges, and then that goes out to the insurance company electronically, and the insurance company responds electronically. That payment or that denial gets posted electronically. Then the computer system, that whatever that provider is using, will automatically generate a bill that then goes out to you. So you can see how there's a lot of room for error because nobody's checked to make sure any of those things were accurate or correct. Um, and there's a lot of regulations and rules in billing that a lot of these entry level people that are processing these bills aren't even aware of, which is why I got involved recently with, well, I guess it's been a year now. I joined a survivor group for COVID patients on Facebook, and was just reading about these people with these ridiculous hospital bills, and I knew that it was a mistake. So I started volunteering my expertise to help these people, contact the places that were billing them and getting these bills corrected, and they ended up owing nothing. So the that I'll kind of stop there. That's a lot. I just wanted to give you that high level overview of what happens, how that claim's created, and how oftentimes a person, an actual human being, never even touches the account when by the time you get that bill. So I guess I'll stop there. And do you guys have any questions about what I've already told you, or anything else, really?
Yes, I actually do. Um, so I have a bill that was created. So it was from the beginning of my accident, and what happened was they took me to the my local hospital, and a bill created from there about 5 grand, and then that jumped up to then you got the helicopter one, which is another 10 grand, and so but what happened is because I got injured, and then they sent me there, then they air vac me to the burn center. They never actually they my workman's comp never paid the bill, and so I contacted my local hospital and I asked them about it, but they would never try to like they would the insurance would never try to accept that. What would you do?
So did you have, I mean, it was a workers' comp case that was approved. You had an adjuster and a claim and all of that?
Yes.
Okay, so if that is the case, then the hospital, the ambulance company, the air ambulance, all of those places should be billing your workers' comp. And if it is a true workers' comp claim where you have the claim number and the adjuster, and in the accident, everything was related to that injury, it is, I don't want to use the words illegal, but I think it's pretty illegal for them to bill you for anything related to a workers' comp injury. Have you spoken to your adjuster about the issue?
Yes, I actually notified them, and I sent a uh, notification to the insurance, and then the adjuster, and I also sent a notice to the hospital saying and explaining to them that I was hurt on the job, and explained what happened and notified them, and that then I even spoke to the hospital, one of the hospital people that were in charge, and they had told me that there was workman's comp had never notified them, and that they would, if I could get them the information. Well, I got them the information of the insurance, but they would never, the insurance refused, or they not refused, but they never got in touch with each other, they said.
So the hospital never billed that workers' comp insurance?
Correct.
Yeah,
just sent me the bill.
that's difficult. I mean, honestly, I would call the number on the bill or the hospital and ask to speak to a supervisor or a manager and let them know that is a workers' comp case. They shouldn't be billing you. You have provided them with the information, and that they must bill workers' comp. And if they can give you any reason why they didn't, or if they did and maybe the workers' comp insurance denied it, then there's other steps you can take, specifically like, was it coded correctly? Was it coded as an accident, as an injury related? There's I don't even know, 100 or so. I think that's a wrong number. I know at least up to 63 different fields on the claim form that have to be populated with various information that tells the hospital and the insurance company the type of claim it is. So if there's no injury diagnosis or injury procedure code, that could have been part of a problem. But without knowing actual details of why they didn't bill the workers' comp carrier, I'm not quite sure. But if you can find out that information, and Lori, I'm sure you can leave everyone my contact information. I'd be happy to follow up and help with some of these issues.
Yes, that's definitely
Okay.
something I can do. And if any of you all are wanting for information after the session, just please let me know as well too. And then I'll make sure that I get it out to you all.
Yes, I know that didn't answer
you.
your question directly, but the first step is just to call them and ask them why they haven't billed workers' comp.
Sounds good. Thank you. Appreciate your help.
You bet. You bet. I had at one point when my grandmother was, I don't know if she had moved into assisted living yet or not, but she was in a facility, and she ended up having to go to I think it was after one of her hip surgeries or something, because she was in a skilled nursing facility and she had to go to the hospital for something. And so an ambulance took her. This is in rural Montana, so of course it was a huge bill. And my mom was handling all the bills at the time, and she got this huge ambulance bill and she was about to pay it. And I said, Mom, don't pay that. By law, if grandma is in the nursing home for a covered stay, then any transportation to and from a hospital for related services is covered under that same Medicare benefit. You don't owe that. I think it was like $1,000 bill that my mom was just going to try to pay out of my grandma's, her monthly Social Security that she got. So it's so important that you double check everything against what your insurance has told you. And if what your insurance has told you doesn't make sense, then it's even more important to call your insurance and ask them why you owe, what they're saying you owe. Any other questions? I know I get from other friends and family, they've gotten bills for things that weren't authorized. And if your insurance is contracted with that provider, they cannot bill you for something that is their responsibility to obtain. They have a contractual agreement to get that authorization. So if they balance bill a patient, they are breaking the law. There's so much that can go on. Like I said, it's all automated. We're relying on that automation to make our work less expensive. But it causes a lot of errors.
I actually had a question.
Okay.
So my injury was completely workplace related. So workman's comp should cover everything, right?
100%.
100%. Like I shouldn't be paying anything out of pocket, right?
Unless there's any sort of limitations on the policy, maybe something weird like that. But I have never seen a patient get billed for a workers' comp. I mean, it's like I said, I don't want to use the word illegal because I don't know if but it's regulatory. You can't do that.
Right, because I know when I talked with them, they were very specific about it pays for everything medical, but it's like, well, what about anything else that might come with my hospital bill?
Oh, what do you mean?
They said that they were paying for everything that's medical related, but not anything else or something like that. I don't know. I
Yeah.
was honestly, when I was talking with my case manager, I was honestly so out of it because I've literally been here like a week. I've been pumped up on pain pills. Like I've been out of I've been out of it this entire time.
Mhm.
So I didn't really know what's left or right.
Yeah.
But I shouldn't have to worry about any bills getting sent my way for my injury at all, right?
Correct, for medical bills, right? And then maybe your work has some sort of disability that'll help cover, salary that you're missing.
Yeah,
But
they did say something about that, but they have yet to get back to me with what kind of numbers they're gonna be coming
yeah,
up with. I don't know. It's
but yeah, you shouldn't get any medical bills. And you're in the hospital, I'm assuming right now.
yeah,
So one thing that's also good to know, everybody, that when you're in the hospital or you go see a physician for an outpatient visit that's in a hospital, you are more than likely going to get several bills. You're going to get a bill from the hospital. If you're inpatient, like it looks like you are, David, you're going to
yeah.
get bills from all the specialists, all the whatever the specialists and the tech. What is the word? I can't think right now. The radiology tech, the surgery tech, like all of those extra things. Anyone who's reading your radiology results, you're going to get bills for those. You're going to get bills from the physicians. You're going to get bills from the hospital, ambulance, any transportation. But if it's coded as workers' comp there at the hospital, that's what drives all those other providers' bills. So they should also all get that workers' comp information. You shouldn't have to mess with that. But if you do ever get a bill, you just need to make sure, call them and tell them it's related to workers' comp.
Cool. Thank you.
You bet.
Just an additional aside to that, with workers' comp, from what I've seen, just from the burn survivors that I've dealt with workers' comp, typically they'll pay a portion of your salary during the time that you are out. Typically with most, it has been 2/3, but if they do not talk with you about that, I would bring that up with them, because quintessentially I've seen that with all of our workers' comp cases. As far as the emotional, in terms of if you need counseling or those type of supports, I haven't always seen those covered. At times I have, but that's also an additional benefit of our Burn Foundation. If someone needs that, someone wants that, we do have a separate salary portion for that we can assist in paying for that if it's not covered by your insurance, just so you know and you're aware of as well.
Yeah, thank you.
No other questions? Don't be shy. Even if it's not a billing, if you just any random weird hospital question, maybe I can satisfy someone's curiosity. I don't know.
I actually did have one, and it's kind of from someone who wasn't able to attend tonight, because there's a few I know that wanted to hear you, but that just due to surgeries and other things, they aren't here. One of them was, now if I can remember exactly, one of them was with regards to what if you get billed for something that is technically, related to your care, related to your healing, but insurance is not covering it. They should, they're not covering it. How would you broach that?
So the first thing I would do is call the insurance and ask why they're not covering it. It's either going to, so it's important to know your plan benefits, what type of coverage you have. But I'll be honest with you, I don't even know what kind of coverage I have. I just know I have insurance through my employer and they should pay for everything, right? I don't know all the specifics, but anything that's elective or scheduled most often requires a pre-authorization, and that's something the provider has to get for you. And if you're Medicare or with a contracted payer, with that doctor or that hospital's contracted with that payer, and you do get a denial for non-covered, most oftentimes that is the provider's responsibility to have informed you ahead of time that you will owe that amount. For Medicare patients, it's a law. They have to inform you ahead of time. Otherwise, you will never have to pay that. You have to sign what's called an advanced beneficiary notice that specifically lays out what's not going to be covered and how much you will owe. But there's a lot of times, my little brother, he had COVID. He went into the hospital, hit his head on the ground or something. He fell down, went to the hospital. And now he got a bill saying it's not covered because he went to an out-of-network provider or something, but he couldn't go to any other ER where he lives because they weren't accepting anyone because of COVID. So I said, you can write an appeal based on the reason why you had to go where you went, and it should be covered. So they can say it's non-covered because maybe the coding was wrong. They can say non-covered because maybe the authorization wasn't obtained. They can say non-covered because it could be a plan exclusion. Like, I went and got LASIK, right? I went and got LASIK on my eyes, not for cataract or anything like that. It was purely elective. So of course my insurance is going to deny that as non-covered. But yeah, if you feel like it should have been covered, meaning it was medically necessary, this was something you either had scheduled, planned, or emergency, and it was necessary for your life, for your comfort, your well-being, it should be paid for. So you definitely want to call and ask them details on that.
Real quick, my question is, do they have to disclose to you why it was denied or why it wasn't covered?
The insurance company, I mean, they definitely should.
Yeah, so I've had surgeries that I was going to get or things I was going to get, but then they would say it was not covered, but they wouldn't tell me why.
Before you had the services done, you mean?
Yes.
Okay, so that sounds like what's happening is that the provider is asking for an authorization to perform those services, but whatever medical documentation that they sent in to the insurance plan didn't support the medical necessity, the need to have whatever procedure it was performed. So the insurance company is saying, hey, doctor, you didn't send me proof that this guy really needs this, so we're not going to authorize it, therefore we're not going to cover it. So it's really back onto that physician and his documentation and what they have written down and submitted to the payer.
Okay, thank you.
You bet. And you should be able to call, it's a UR or UM, utilization review, utilization management department at the insurance, and ask them, hey, I see that you didn't approve this procedure or this surgery. What was missing? What do I need to do? What needs to happen? I mean, that should be taken care of at the hospital or the provider's office, but you guys, we've got to, as patients, we've got to start taking control over this, and being our own advocates. And that's why I'm doing this, just getting out there and making sure you understand all of that. The hospital staff, I have 90 people reporting up to me right now. They're entry level, they're lazy, they don't want to do their job, they just want to pass it off to the next person. So, they're going to get that denial letter and they'll be like, all right, well, we'll move on to the next patient. But you, as the patient who really wants and needs that care, if your providers aren't being those advocates for you, pick up the phone, call that insurance company and get details from them, demand details from them. You're paying for that coverage, or your employer, someone's paying for that coverage. You know what I mean? I try to say don't take no for an answer, but it's difficult. It's really difficult with these companies.
Have you ever heard of it being common where workman's comp will deny it, and then so that Access will take it, or that the claims adjuster will deny it, so that then Access takes it, or they'll try to talk you into getting the access so that they don't have to pay for it?
That's really scary. So Access, if you talk to anyone from the state, a state advocate, they are the payer of last resort. If there's anything on that claim or in the medical record suggesting this was related to a work injury, they're not going to pay it. They're going to go after that work comp company. So that adjuster has to have a very good reason as to why they're not considering it work related, why they're not covering it. The state, Access or Medicaid, the state will look into that, and they guarantee you they'll come back 3 years later and take their money back if they find, a post-payment audit and they found that, oh, let's pull all of the claims with this diagnosis code or something, and let's do a look back at 3 years. So for an adjuster to deny it, saying that you should bill Access doesn't sound very ethical to me. Again, I don't want to use the word legal, illegal, because I don't know the law, but it doesn't sound very right to me.
Yeah, I've had a few of those. So that's the reason why I asked. Thank you.
Yeah, you bet. Just another little tip. So, anytime you are in the hospital, especially an inpatient stay, and I'm sure, David, you've experienced this, there should always be a team of financial counselors, medical assistants, whoever, who try to come bedside and talk to you about your financial obligation. I know recently, especially with the passing of the ACA, and the Healthcare Financial Management Association, HFMA, they're working with ACA in rolling out all of these new rules and regulations of what has to occur, either, if it was an emergency by the time you've been treated, or before scheduled service, or when you're in the hospital, to tell you exactly what your bill is going to be expected and how you can pay for it. So, they'll come in to make sure you have insurance, because right now, David, I guarantee you, whatever insurance they have on file for you, the nurses are calling and faxing information to that payer every other day. They have to get your stay approved. It's a minimum every other day that they have to send clinical documentation to the payer to get each day approved for your stay. But so that conversation is going to start happening. I think there's going to be more regulations around it. Price transparency, I don't know if you guys have seen that in the news, but there's a lot going on that's really really good legislation that's coming out that's intended to protect the patient. And so there's no surprise billing after you've seen someone. I actually just took my HFMA Certified Revenue Cycle Representative course. I took it last in 2013, and I just recently took it like last week, and I couldn't believe all the new stuff regarding ACA, regarding even COVID, that was in there. And it was very nice to see that there's a lot geared towards protecting the patient from surprise bills. I think the whole point of that, I forgot, is people who don't have insurance, or even if you do have insurance and maybe you don't qualify for access, most hospitals have a charity program, a free care program. It's there to help people who don't have the means to pay the bill, which, I mean, I have a very good job, but if I were to have a traumatic event or any sort of inpatient hospital stay, there's no way I could afford that. So they do have payment plans, charity programs, all kinds of things that can help the patient out. There's always an option if you get a large bill.
Yeah, no, there's definitely been people that have they've called me to talk about that sort of stuff, because I'm actually in the COVID wing too.
Oh, great.
So yeah, so I'm having all sorts of fun this week.
At least you got a private room, right?
Yeah, no, I do have a private room.
Make sure they don't bill you for that.
Oh no, no. They I know that they have workman's comp on my as my insurance, because like when I talked with the claims manager or whoever it was that works at this hospital, she said that the insurance that they have on file is workman's comp.
Cool.
So I'm like, okay, cool.
Yeah.
Cool. It's like I'm not trying to deal with like all that headache on top of just healing and recovering, because
Isn't that terrible? Yeah. I'll give you guys my email address, or Lori will give you my email address. So, I mean, once you get out of the hospital, a month or 2 months later, you're going to start getting EOBs maybe from the workers' comp saying what they're doing with the claims as far as the hospital. So you, or even Bobby, if you guys have more questions, you can always email me and we can get in touch that way. Cause I don't want anyone to have to go through that. It's terrible. It's my stepbrother had an aneurysm. I think it was earlier this summer, because I went to Montana right after it happened. He had the type of aneurysm he had was a 1% chance of survival. But he's fine. He's totally fine, thank God. But they don't have any money. His wife is on disability. He works at a tractor supply store. So I helped them get financial assistance and fill out the charity application. So their entire care, everything was covered. And that assistance it can go back to, sometimes depending on the program at that hospital, can be retroactive back to a year, maybe 90 days, and it lasts for a year. So any care he has to go see for follow-up visits, it's all covered.
okay, cool. Yeah, that because I know that I'm gonna have to come back for follow-ups and stuff like that. Because like actually I should be getting out of the hospital sometime in the next couple days.
Oh, good, good.
They actually offered it to me today, but my surgeon was like, yeah, you just don't quite seem strong enough that I feel comfortable. I'm like, Okay, yeah, no, I'll stay here for another day or two. Even though I really want to go home.
Love being in the hospital. I guess I'm just weird that way. I had a surgery once that had me stay in the hospital for 3 days and I didn't want to leave. I was like, this is awesome. People are bringing me food and I just get to lay here and watch TV. But that's
Yeah,
me. I'm extremely lazy.
yeah, but also like with the COVID protocols and stuff like that, they all have to like
Yeah.
gown up and mask up and like so if I do
Yeah,
anything, it takes them an extra 5 minutes to get in here because
that's
they
true.
can't just come in here because even though to be perfectly honest, I think I might have gotten a false positive.
Mm.
Um, but they're not gonna retest me because it's controversial or something like that. But
Well,
yeah, no, when I came in, I got a positive test and like my roommates are like, yeah, no, we're not feeling any symptoms. We're fine.
yeah.
So
Oh,
so
well, whatever the result is, really, I hope you feel better soon. I really do.
yeah, it'll be a lot better to be in my own bed and get to see my dog. I miss
Oh,
my
yeah,
puppy.
that makes a difference.
I miss my puppy.
I think if we could just end on like this last point, Jaymi, if that's okay with you, what would be the best way, or how would you recommend individuals best advocate themselves, best kind of make sure that they're getting things appropriate billing wise? If they have any questions on things or concerns, how would you best recommend that someone advocate for themselves? Because it can be hard to take on something entirely additional in your healing. I mean, it's stressful enough dealing with the physical and the emotional and the changes, but taking on the financial aspect of care, how would you best recommend in terms of advocacy for yourself?
Yeah, again, if it's pre-scheduled or elective, it's something ahead of time. Ask as many questions until you have the answers that you want. Again, I mentioned that the frontline staff, maybe the people that you're working with, may not be the most knowledgeable on everything. I know, so before I moved here, I was in Louisiana and I oversaw 2 different hospitals. And we call them, what was it, medical eligibility screening team. They didn't know all the rules and all the laws. I mean, they just knew to go get certain documents and send them into the state to try to apply for medical assistance. So keep asking questions until you're satisfied. And then after the fact, after you've gotten a bill, or you've received a bill and you have insurance, make sure the amount your insurance EOB, which is the explanation of benefits, make sure that amount matches what the actual bill is that you're getting. And if they don't match, that's your first red flag. But if it's anything outside of coinsurance or deductible or your copay, that's also kind of a red flag because those are the only things that you should have to pay. Anything else probably got denied for some reason. And, that's what my job is fighting denials. Nothing should be denied. Everything should be paid. But it is hard. It's a different language trying to speak to some of these people. And again, when you call into billing or customer service, that person probably doesn't know a whole lot about what's going on. I'm actually helping a family here, another one that contacted me after the news aired. It was my own company that I worked for 11 years before I got laid off from COVID. And I can't get them to help. I cannot get through to someone who will help us. So I actually went to my old boss, who's the VP. And I said, listen, we have called the dispute number. We've called the hospital. We have called everyone and no one will help us. So it's difficult even for an expert or a professional in this field. I couldn't even get answers, or it was a coding issue. They just need to send the claim back for coding and rebill it. And I just couldn't get anyone to help us. So I'm here. I do this for free. I want to help people. So, for anyone that's on this call or gets this information, they could email me. And then, at that point, I'll get information from you and then we can talk over the phone. But, if you can't get the answers you need or the help you need, feel free to reach out to me.
Thank you so much for coming, Jaymi. We really appreciate your advice, your expertise, your knowledge in this area, because I think it's definitely something that we all can be mindful of in any type of hospital medical interactions forward, just for our own self-advocacy, and that we aren't, overpaying what we should be. So we're very appreciative for all the advice that you've offered, and thank you so much for being here tonight.
Awesome. Thank you. Thank you guys for having me. It was my pleasure. Okay.